Good evening, ladies and gentlemen. I'm Munson Steve with Rolling Out. We are here this evening. We thank you. It is an exciting moment for us all. I am joined by two distinguished doctors and guests. You each would introduce yourselves. Dr. Reddick.
Hi, good evening. Can everybody hear me okay?
Yes.
Okay, perfect.
Yes, sir.
So, I'm Dr. Bonzo Reddick. I'm a family physician at J.C. Lewis Primary Healthcare Center, right near the Oglethorpe Mall. I'm also on faculty in the chair of community medicine at Mercer University School of Medicine. I'm a Savannah native, born and raised here, grew up in Cloverdale, and I'm happy to be here with you all today. The way I've been involved in this whole, the way I've been involved with COVID is that I've been a part of the Department of Public Health Equity Council. So we're just overseeing the whole process of rollout of vaccination for the COVID-19 vaccine to be sure it's presented in an equitable and fair manner, especially for vulnerable or marginalized communities. And also I've been on the mayor's task force and also an advisor for the Savannah Chatham County Public School System. Happy to be here tonight. Thanks for having me.
Mr. Benning.
Good evening. Thank y'all for having me as well this evening. I am also a member of the Health Equity Council, as Dr. Reddick just stated. I am the second vice president for the Georgia State Conference of the NAACP, as well as the current president for the Bartow County chapter of the NAACP here in Bartow County. As Dr. Reddick said, as part of the Health Equity Council, we just want to make sure that folks are getting the vaccine equitably, that we have distribution, and that we can do whatever we can to facilitate folks being able to get the vaccine. So that's our part of our role, and thank you for having me here this evening.
All right, I'm Munson Steve, CEO of Rolling Out. We've been involved in COVID outreach. We've been involved in showcasing stakeholders and clearly the individuals who are trusted voices for our community. I'd like to begin with Dr. Reddick. What would you say are some of the myths that our community truly needs to address, and how we can share a trusted voice from a physician like yourself?
Thank you. So I think a lot of the myths, I'll just kind of start with the COVID itself. Some of the myths that I've heard are that COVID doesn't really exist, that COVID is just a flu and that we're just calling it something different and it's here for political reasons. So that's the first myth that's there. If I can just kind of address them as I bring them up, if you don't mind, real quickly. The biggest thing about COVID is that we know for a fact that people, for whatever reason, whether or not you believe COVID exists or not, have been dying at a just exponentially higher rate than we've ever seen in my lifetime. Even if you thought that all the deaths from COVID, the 600,000, 700,000 deaths from COVID were really the flu, that would be the deadliest flu season of my lifetime by more than tenfold. So in previous years, we would consider it a bad year for the flu if we had about 40,000 deaths. Multiply that by 10, that would be 400,000 deaths. We've had about 700,000 deaths. So whether or not you call it COVID or call it the new super flu or whatever it is, we know that this respiratory infection is killing way more people than anything we've seen in more than 100 years in this country. Second thing that I hear people talk about, the myth is that about the vaccines, is that it's just a way to kind of poison people in the population or to implant microchips into them, or that it's just a way to make drug companies money and a lot of things around that. And that was something that was specifically targeted towards Black people and Latino people, kind of people of color, or the other things I've heard as well. The biggest thing I knew about that was that that's just not the way it's been rolled out as far as the vaccine goes. That our Health Equity Council wouldn't exist if that was happening. You know, if you look at things like, a lot of people bring up things like the Tuskegee experiment, because our country does have a bad history of experimentation upon Black people. But the difference with that is, if you look at everybody in the Tuskegee experiment, every single person in the Tuskegee experiment was Black, every single one. When it came to the COVID vaccine, the first people that were lining up were non-Black people. You had white people literally in certain neighborhoods where they were prioritizing certain zip codes in California who were going and stealing people's logins to try to get the vaccine before Black people got it. So, so that's another myth that I kind of bring up that I address. And the last thing is, you look at studies of COVID vaccinations, those studies were not primarily of Black people, they were a mix of a lot of people. So again, this doesn't follow the pattern of any kind of thing in our history that's been targeting Black people, because I do know that has existed in our country for sure. That's not something that people are making up without some good reason for believing that, because our country does have a dark history. But if you look at the pattern about all those past situations where Black people were exploited, COVID-19 doesn't fit any aspect of any of those, like no patterns whatsoever.
Absolutely.
You know, Dr. Reddick, you make a great case, but now we have the holidays upon us. We really are getting ready to mingle. Just some insight, if you would, you know, Mr. Benning, what should we really be doing as a family and as a community as we begin to gather and be conscious of how we're gathering? And then, Doctor, after you hear what he has to say, if you'll just share the insight on what we really know as a community from a medical professional we should do when we gather with our grandmothers, with our aunts, and how do we ask each other with respect how we can address, are you vaccinated or not when you're with family? Mr. Benny?
Well, Doctor, thank you again. You alluded to it. The first thing is that you need to be vaccinated if you're gonna. You need to be vaccinated, period. But you need to be vaccinated in particular if you're gonna gather with family. One of the things that was posed to me, is it appropriate to ask your guests to be vaccinated? And the answer is absolutely yes. If you're going to congregate with folks, you need to be vaccinated. And if you're eligible for the booster, you need to be boosted as well. So we're really imploring people, our way out of this is to be vaccinated. If you want to get back to some sense of normality and be able to spend time with your family and do the things that we've done in the past, vaccines are going to be the answer to getting that done, as well as all the other mitigating circumstances or mitigating things that you can do, i.e. washing your hands, i.e. social distancing, i.e. having your mask on. So we're asking people to continue to do all those mitigating things, but the key to it is to be vaccinated. And if you're going to congregate indoors, try to have it ventilated, try to open windows if you possibly can. If you can eat outdoors and the weather permits it, try to be outdoors. All those things. But you know, I went to Thanksgiving in Michigan and we asked that everybody that came be vaccinated. And if you were not vaccinated, we wanted to see you. You could call in on Zoom, but we didn't want you in the house. And that's just the steps that we have to take right now.
Dr. Benning, just from a medical, not
Benning.
Dr. Benning, I got you. Dr. Reddick, I got two brothers. I would go to brother, but at any rate, I think there's also myths just with gathering. Everybody's not going to be honest. When I visited my mother, I actually continued to wear my mask. And she was surprised. She says, I'm vaccinated, but I elected to wear my mask. What are the behaviors that those of us who do care, and what does the mask play a role as we do go into these holidays and want to protect family members and even meet his family?
And so I think the first thing to remind people is that the way masks work is that me wearing a mask, the most benefit is that I don't spread it to somebody else. The mask also does decrease my chance of catching it from somebody else, but the bigger benefit is the person wearing the mask is not likely to spread it to somebody else. Disgusting analogy, but it gets the point clear because people don't understand that and people argue about that all the time. There's a joke that somebody makes about somebody accidentally urinating on your leg, right? If the person has on pants and urinates on themselves and they're wearing the pants, none's going to get on you if you're standing a few feet away. If you have on the pants and they don't, some's going to get on you, but it won't actually probably get through to your skin. It'll just feel disgusting. If neither of y'all have on pants, it's going to be disgusting. I apologize for that terrible visual, but it's because people argue about the mask. Why should I wear a mask? Or well, they don't have a mask on, so why should I have one on? It's more of a personal responsibility thing of you saying, I'm not going to spread it to somebody else. And again, if somebody else doesn't have their mask on and you have it on, that does decrease your risk, but it's not as effective as that person who has COVID wearing the mask. So with that being said, even if you feel good about yourself, that you're vaccinated, and that if you catch COVID, you're probably not going to get very sick from it, because that's the main benefit. I haven't mentioned that yet tonight. The main benefit of the COVID vaccine is that if you catch COVID, well, first of all, you're less likely to catch it. But if you do catch it, you have almost no chance of dying or ending up in the hospital. So a lot of people say, well, I'm vaccinated, so why do I have to wear a mask around somebody else? Well, the reason why is because you could still carry COVID and not be sick from it if you're vaccinated. And so you wearing the mask stops you from spreading it to other people. And so that's why it is still important to do that, in particular if you're around anybody that has a weakened immune system. So suppose you're around anybody that has HIV, that's undergoing cancer treatment, that maybe is undergoing treatment that suppresses their immune system, like people who have lupus, Crohn's disease, ulcerative colitis, any of those kind of conditions. So if you're around family members that have those kind of conditions, that have any medical problems, or people over age 65, then it's not a bad thing to decide to wear a mask around them, especially if you're going to be within 6 feet of them for more than 15 minutes at a time indoors. So long story short is wearing that mask helps you not spread it to other people, even if you're vaccinated, because you could have it and feel fine, especially if you're vaccinated. You might get it. I saw 7 patients with COVID last week. I feel great, but I could have some COVID in my body. It's just the vaccine's helping me fight it off possibly. So for me, I wear a mask when I'm indoors, when I'm in the grocery store, whenever I'm in public, I always wear it just because I don't want to spread it to other people. So nothing wrong with doing that. If people ask you why you're wearing the mask, you know what, just in case anybody here is unvaccinated and they didn't want to say anything. But just in case somebody here is unvaccinated and they were embarrassed to say it, just so I don't spread it to somebody else. That's the way I deal with it.
Can I add a little bit to that too, real quick, real briefly?
Of course.
Dr. Reddick was alluding to this, and what I tell people is, and of course, I'm not a doctor. I'm not. Let's clear that up. But asymptomatic spread. So as Dr. Reddick was referring to, you can feel great, but you could still be shedding the virus, and that's what we're really trying to get people to understand. So my mask protects you, as well as it prevents me from spreading the disease if I'm asymptomatic. And I think that's where people miss the ball at. You can be asymptomatic and shedding the virus.
And part of what I was suggesting is families really can enjoy covering and wearing a mask in an event. You can create a new norm during COVID.
Especially if there's anybody who is not going to be vaccinated, especially that.
You know, I just think truth is one of those things that we need to err on the side of safety and kind of look forward to Christmas pictures with a few people wearing masks at the end of the day, you know, mask at the front door. I think that we want to trust each other, but if we're going to love each other, we've got to be there. But Brother Bennings, you clearly are part of a historic organization. Community members have to engage. How can they get engaged with community organizations now to really help our community understand and partner with these community organizations to either get friends, family, children, schools involved? Can you give us some insight?
Yeah, so really what we're trying to do at the NAACP is reach all our partners. But one of our biggest partners in the African-American community is the churches. And we work really closely with churches, trying to ensure that the churches advocate for all the mitigating factors, that the churches advocate for vaccines, and that people understand, again, for us to get back to some sense of normality, these are the steps that we're going to have to take, and these are the things that we're going to have to do. So we really are engaging our churches. We're engaging all our community partners. I like to call them our stakeholders that have a vested interest in seeing us turn the corner. And as Dr. Reddick stated earlier, this pandemic has disproportionately affected African-American folks and Latino people of color. So we want to make sure that we highlight that and let you know that, listen, it's going to take an all hands on deck approach to solve this, but we've got some really serious issues ourselves, partly because of the morbidities that exist already in our healthcare, you know, high blood pressure, diabetes, you know, the list goes on and on of things that we have, as well as, not to mention, being underserved at going to the doctor. So if you're not being seen by a doctor, you haven't been seen in 3 years or 5 years, and now COVID's on the scene, we need all that, and we need correct information. You said it a second ago. We really do need to be truth. We need people to hear the truth and let them know that what we're telling you and what people are advocating and what people are promoting is absolutely the truth. And the myths and the misinformation and the politicization of all this has really been problematic. But for us, we're trying to engage all our community partners, and in particular, the Black church and all churches for that matter, and anybody that'll listen. You know, I have a radio talk show. I'm on air every Saturday talking about it. I say I'm not going to talk about it this week. Before I get halfway through my show, I'm talking about it. I've been in the newspaper. Anywhere that'll let me say anything that can help our people, I'm there on the spot to try to make sure that we get that information out.
You know, Dr. Reddick, maybe our community doesn't know that Morehouse Medical School is actually part of the research team, and that all 4 Black medical schools have actually participated in research. When people are traveling and actually moving around to kind of understand protocol and is it a cold versus is it COVID, what should they know, and how is testing and even portable testing, since many people need, maybe that's something they should bring. And I'm not certain, not a doctor, but what would you recommend tested, getting symptoms, and how to protect the family as we continue to move in these holidays?
So we've already, Mr. Benning already kind of mentioned a lot of the big things for protection while you're moving around, which is good hand washing, good sanitation, and also wearing your mask as well. It's amazing, nowadays things are the way they probably should have been years ago, which is everywhere you go, there's hand sanitizer everywhere, right? I don't see very many people walking out of the bathroom. That was one thing that always disgusted me, is seeing people use the bathroom in the men's room and just kind of walk out without washing their hands. I haven't seen that in a long time. So everybody's washing their hands like crazy, which is good. So those are kind of the basic things. But in addition to that, if you're having symptoms, the big symptom of COVID that people have mentioned that a lot of people probably already know about is loss of taste or smell. So that's something that wasn't as common with kind of the common cold or flu in past years, but that's something that's kind of unique to COVID. So if you have any fevers, upper respiratory symptoms like cough, cold, in particular, if you ever feel short of breath, have high fevers, anything like that. And when we say a fever, we mean anything above 100.4 on the Fahrenheit scale, or if you're using one that has Celsius above 38, and that's what we consider a fever. So anything like that with a cough and cold symptoms, you should get checked out. And definitely, if you ever have loss of taste or smell associated with any of those symptoms, you definitely should get checked out immediately. Now, keep in mind that COVID testing and the COVID vaccine have all been made available free in this country. So even if you don't have healthcare insurance, you can typically find a federally qualified health center or an FQHC in almost any jurisdiction and find one where there's testing available. The Department of Public Health in Georgia has made a lot of places available. You can usually go onto the website and find places to get tested or get vaccinated. And most other states are similar. So you can just usually go to the county health department or either the Department of Public Health for whatever state you might be traveling to and find access to testing. Typically, it's not available. So a lot of people are surprised, but sometimes people just show up in the emergency room not really having many symptoms saying, hey, I just want to get a COVID test. And a lot of times people will turn you away. So I recommend people contact their county health departments and the departments of public health, and you can usually get access to those. But again, if you have any of those symptoms of loss of taste or smell, fevers, worsening cough or cold symptoms beyond just a little runny nose, you should probably get checked out.
Mr. Benning, what would you say to a family that is literally working to figure out how to host an event and properly invite the team in, the family in? What do you think preparation should look like? Emails before you get there? You said you traveled to Michigan. What was that respect to keep everybody from melting down? That you guys, can you share that process with the community?
Well, emails and communication is absolutely key. Post and pre and post testing, I think, is absolutely paramount as well. I took a test before I left. I took a test when I got back. I wouldn't even have been opposed if my uncle would have had tests at his house for people to take tests when they get there. One of the questions that I was on my list was, should people be tested or should they be offended? Absolutely, you should be tested, and you should not be offended if someone asks you to provide a test or take a test, a rapid test or whatever. The PCR tests are absolutely more accurate, but the rapid tests do provide some level of security that you are not exhibiting symptoms, at least at that current time. Even with the PCR, you can take the test and later on still have symptoms. But I think it is absolute paramount that we communicate and that we understand that this is not, it's almost like it's not personal, it's business. This is not personal. This is to keep everybody safe and healthy and alive, because God forbid we have one person that comes in here that is shedding the virus, that is asymptomatic, and get grandma, Aunt Susie, Uncle Willie, and everybody else in the house sick because they didn't take the necessary steps. And the other thing that I really wanted to make sure that I told my family was no chin diapers. If you're wearing a mask, wear the mask. I mean, this is not a chin diaper contest to see who can, do that. So if you're gonna wear it properly and make sure, and I had a problem with one of my aunts, she was preparing some of the food and she didn't have a mask on or the gloves or anything. And I didn't feel comfortable with that. And I said something to her and she put on gloves. And I told her later, I said, Auntie, it's nothing personal. It's just that I think it's safer for everybody to do whatever they can to make sure that we're mitigating. So we had plenty of sanitizers, people wash their hands. We tried to encourage people. We kept doors open. We did all those things. And you just got to understand it's not personal. It's just safety.
Doc, you heard that. Do you have anything to add to that? I think it's important that we share, protocol.
Yeah, and Brother Benny kind of definitely nailed it on that one. But yeah, I guess I would say the main thing is if somebody does ask you to do something that you think is overkill. I've seen all these videos on social media or whatever, where people are getting into arguments with folks and calling them scaredy cats or whatever it is. And the main thing is you just never know what somebody's dealing with. Somebody could have a private medical issue going on that they don't want to share with somebody. Maybe they're battling cancer. Maybe they just got diagnosed with rheumatoid arthritis and they're on chronic steroids now, which makes them vulnerable. One of my buddies is a transplant patient, and you look at him, unless he were to lift his shirt up and you saw his surgical scars, you have no idea just looking at him that he's had a heart and a liver transplant. And for him, he got the vaccine 2 different times and had no detectable antibodies, like as if he never even got it, because the medicines he takes suppress his immune system so much that he could not mount the response. So he needs people around him to get the vaccines because they can mount a response and be protected and be less likely to spread it to him. So for him, when people like his family members and other people, his family members know what medical history he has, but he says that people tease him from time to time when they see him with a mask, or he double masks sometimes, or he's scared not scared to, but he doesn't want to go within 6 feet of people even when he's indoors. And people sometimes give him a hard time about it. I just encourage people to just show some grace, because you never know what medical problems people are dealing with. I know a lot of really healthy, people that have HIV and breast cancer and all kinds of things. You would never know it just looking at them.
I think we're getting in a moment that, Mr. Benning, you're at a critical juncture where people are getting shots that as you encourage them and you say get people that haven't gotten their booster. If you would kind of share with us exactly what you're suggesting people who've gotten two shots and are on the fence, how do you say, or help them toward getting a booster? What's the message now? We may have lost him there for a minute.
I'm back.
Okay. Hey.
I don't know what happened.
Technology. So in the case now, we know that many people in our community have gotten 1 shot, 2 shots. They may not be getting the booster. What should we share, and how can we share and encourage individuals to actually get that booster now that you got the 2nd shot? I'm not sure what the question is, and I'm going to ask the same of you, Dr. Reddick, because it seems like this puzzle. I took the first 2 for the team. Now I ain't going to take no more.
So I'm assuming you asked me this first. So, man, I had that exact scenario play out while I was in Michigan with one of my family members that came. My uncle's daughter came from New York. She has lupus, and she actually had both of the vaccines. And she's like, I'm not getting the booster. I'm like, Vanessa, and I hate to call her name, so I hope she don't hear this, but you got to get the booster. And she was like, no, I'm going to let my body build up the antibodies, and there's no need to get my boosters. And it was almost like I was banging my head against a brick wall, but I would not let that go. And I told her I was going to be following up with her. So I tried to put it on her for her family. Like, do it for your dad. Your dad has Parkinson's and several other things. You're here with him now. Do it for your daughter. She's in high school, around a lot of people. You want to be here for them. So do it for them. So I'm really encouraging people. And the other side about it, the booster doesn't hurt nearly as bad as the first 2 shots, in my opinion. And it's a half a dose. It's easy just get the booster. And if they require an additional booster, you're going to have to get it. So whatever it is that's going to prevent you from getting severe illness and dying and allow you to get back to some sense of normality, we're going to have to do it. If they tell me we got to do a booster every 6 months, I'm in the booster line every 6 months. And people have to realize that, and that's how we have to convey that message to people.
I'd ask the same for you, Doc. I'm not certain, Dr. Reddick, and you did a great job, Brother Benny, but literally there's this quagmire. People are kind of half in and half out. What don't they know about vaccine efficacy? What is it about the whole idea of inoculation that they should understand, that why you would need more than 2 or 3? Can you share some medical insight from a trusted voice like yourself?
Yeah, sure. So I think the biggest thing is that I know one thing you mentioned about myths. This isn't necessarily a myth because this is true. Drug companies are here to make money. That's what they're here for. And so there's always that fear that the boosters are just people trying to make more money. You know, that Pfizer and Moderna and Johnson & Johnson are just trying to make more money, and the more boosters they get is being paid for by the federal government. They want to get people to get as many shots as possible. And that's why I encourage you to not listen just to the drug companies, but listen to what the doctors are saying, listen to what the experts are saying, the epidemiologists, the lay health advisors, listen to what everybody else is saying who's studying this. And that's where you kind of get your information from. Because a lot of times they'll come out and say, oh, I think we're going to need this every 6 months for the rest of our lives. Of course, they're going to say that. The drug companies are going to say that. Listen and see what the World Health Organization, the CDC, the Department of Public Health, physicians in your community, your local primary care physician, like listen to what they're saying. And when you get the overwhelming consensus of doctors saying something, that's when you know it's the case. In the case of COVID, doctors never agree on anything. Like if you ask doctors, about anything, gallbladder disease, heart disease, whatever, blood pressure, what number is the perfect number for blood pressure? Nobody agrees. There's like 3 different guidelines out for blood pressure. But with COVID, you got about 97, 98% of doctors all agreeing on these guidelines that we have. That's unheard of. That's when you know that what we're saying is the case. In the case of the boosters, if you're 6 months after your second shot of either Pfizer or Moderna, then it's time for a booster. If you're more than 2 months out from Johnson & Johnson, then it's time for a booster. And that's because of all the variants that come out. Everybody's hearing about this Omicron variant that's coming out right now. I can't remember. I've heard some people call it Omicron, some people Omicron. If anybody Greek out there, let me know. But the other thing about that is that a lot of people talk about natural immunity, which Mr. Benning kind of mentioned as well. And it is true that some viruses, that people who got the natural immunity from a virus actually have better protection than the vaccine. Chickenpox is a great example. You look at people who had chickenpox like me, like my antibody levels of chickenpox last time they were checked are like through the roof. And I had chickenpox when I was like 2 years old. But every virus is not the same. Just because something's true for one virus does not mean it's true for COVID. Every bacteria is not the same. Some bacteria, certain antibiotics work, certain antibiotics don't work for a different one. Like you cannot do that and just make a blanket statement that, well, I've always heard the natural immunity is best, so that's what we need. It just so turns out that the vaccine, because of how it works, it tends to give you pretty good protection against not only the variant that's out right now, but the other ones that have emerged. The Delta variant, the Omicron variant, those are all give you good protection. And it seems to wane, your protection, your immunity does wane over time. So the same way people who had measles, mumps, rubella, when they were younger, a lot of times they have no antibody levels anymore. For people that have had chickenpox, a lot of times they will have antibodies that last, but some people don't. So respiratory viruses a lot of times are very different because they change so much. So it's not like, if you think about the flu, the common cold, right? You're not immune for life once you get the common cold. A lot of people most people have a couple colds a year. So respiratory viruses are different. Like even if you get natural immunity, it still will drop. The antibodies will still start to drop over time. And the good thing about the vaccine is that with boosters, you can make it last longer and you're more protected against these variants that happen as the virus mutates.
I love that. I really want to speak to the entire Georgia, state of Georgia. We have many other communities, the Hispanic community, and obviously when you have workers and you have community working together and they've got brothers and sisters coming in and out of a smaller household, maybe, what can we do when we have that? If you have people that you know may not be documented, but you really want to help them as well. How can we make sure that we're not just thinking Black community and COVID? It's the entire community. So if there are language barriers, how can you encourage people? You have any idea, Dr. B, how we can make sure that this is an inclusive process and we reaching out to the Hispanic community, the Asian community?
You know, that's a great question. And I'm in Cartersville. I'm in Northwest Georgia. And so we have a lot of rural areas out here of Caucasian people that really don't have access. They may not even have internet or broadband. All those things are lacking in a lot of neighborhoods and a lot of areas up here. So there is a challenge. I think the biggest problem is really trying to get people to get truth, to give out correct information. First of all, we need to stop politicizing this virus. That is absolutely the one of the main problems, is that it's become so political. And if we can get that out of the mix, I think we'll be well on our way to getting some of this solved. But using all those community partners again, going through the churches, going through the food banks. You know, I had the Department of Health sent me a bunch of literature. I passed it out to every person I could and putting it in barbershops and taking it to beauty salons and putting it in the grocery stores and just really trying to make sure that we get that message out to people that this is something that affects everybody. And particularly, again, I said this, people that are underserved medically. If you're in a rural area in rural Georgia and you don't go to the doctor, you don't have health insurance, you don't have expanded Medicaid or whatever, and you can't get to the doctor, you really need to make sure you're on top of this COVID thing. And for our undocumented workers and our undocumented brothers and sisters that are here, we really go to those communities. We use the Hispanic Coalition here in Bartow County. Any voice or anybody, the Asian American, Pan American community, we really try to go and reach out to those communities and go through their trusted leaders to let them be the advocate and the voice to try to get the message out to people that we're really here to serve you. We don't care about your status. We're not worried about whether you're legal or illegal. We just want to make sure that you're healthy and safe, and that this virus, that you don't succumb to this virus from becoming sick.
You know, I love that. We've got Christmas and international travel. So you might be moving back to Chile. You might be flying back to Guadalajara. You might be heading back over to many other destinations. So I guess for me, I know many sell out and they go back and they want to visit home and be with their family. If you're traveling internationally, whether it's Jamaica, Mexico, the south, people who are trying to be snowbirds going further south, that are going to be hanging out in Argentina, and maybe even now, if you can make it to Africa, what should we do? Doctor, what's the protocol for families coming back from whether it's Jamaica, Mexico, or other cities, and how can we inform that community? But what should be that travel protocol be internationally?
So keep in mind, it's very different. It depends on the epidemiology. In other words, kind of the differences in the incidence of disease in different places. So it's going to be different depending on which country you go to. There are travel restrictions that pop up because of outbreaks and hotspots of COVID. So right now, fair or unfair, certain areas in Africa you mentioned earlier, because of this fear of this new variant, they're actually restricting travel back from certain areas sometimes. It will change. So I know in Europe and the UK, I think they're not allowing people to travel from South Africa. So one thing to do is just, honestly, because things can change from day to day, week to week, is that wherever you're planning on traveling to, is just keep an eye on it, whether it's the CDC travel advisories, the websites, and see what those specifics are. Some people require you to have a negative test to enter. I've heard stories about people getting stuck in the airport waiting on their test results to come back, or somebody traveling with a group and one person out of the group tests positive and everybody else is allowed to go on, but that person has to stay back. So be aware of what those restrictions are in the areas you're going to. As far as from a medical safety standpoint, just keep doing about all the things that Mr. Benning and I have been talking about so far tonight. Most of the airlines require you to wear a mask while you're on that. Keep it on while you're moving through the airport. Wash your hands, good use of hand sanitizers. Usually when you get on a plane, they'll hand you the little wipes nowadays. At almost every airline, they're giving them to all the people who walk on airplanes nowadays. I think most of them have that policy now. So you can get there, wipe down your space if you want to, whatever people may have been touching right before you. And so still continue to do those kind of things. And oh, for goodness sake, if you have not gotten vaccinated, please get vaccinated before you go travel. Pretty please.
Can I add one quick thing to that? My business partner is over in Dubai right now, and he's going to be coming back on the 14th. And so now they've changed this where you got to have a test the day before you come back within 24 hours of re-entering the United States. When he left, it was 72 hours, and now it's 24 hours. And I told him, when you get back to the States, don't come in the office. You can keep doing it like you've been in Dubai for a week or so, and get your test results and stuff. And again, it's nothing personal; it's business. And Dubai is one of those places actually really has really good COVID protocol, and I really don't think there's going to be any issues. But we just want to err on the side of caution. We want to make sure that we keep our staff safe, keep him safe, keep myself safe, and just do those kind of things too.
Lastly, just kind of, Doctor, before we go to question and answer, what is a reasonable amount? Both of you gentlemen have actually, well, we know Brother Benny's been to a gathering, but what's a reasonable kind of gathering? Because you're at a moment where it's holiday, churches, some are back open. What are your gathering protocols if you're gonna go to a concert, Christmas concert, if you're gonna attend night watch service for those who may not know, or you're going to mass and you haven't seen the priest in a minute and you want to get some things off your chest and you haven't been to the church and you can actually go in now, and sit with your priest for your mental health. What do you recommend as a protocol? And obviously we'll go to Dr. Reddick and then I'll let you share your insights if you would, Brother Benny.
So as far as kind of numbers, there's no magic number. A lot of places around the country are saying that if there's an indoor arena or something like that, they're having it anywhere from 50 to 70% of capacity is probably a good number. So so if you're going to a place that normally hosts 2,000 people, if they're kind of limiting the seats to about 1,000 to 1,200 people, then that's something that might be more reasonable. But honestly, a lot of it's guesswork when it comes to that. We don't have an exact number, to be honest with you. The really numbers that we know are the things I mentioned earlier, which is that when you're within 6 feet of somebody for more than 15 minutes indoors, that's when you're more likely to spread it. The reason why it's so difficult is because it depends on so many things. Mr. Benning talked about ventilation earlier. If you're in a place that has 40-foot ceilings and it has windows that are open, that's not going to be the same. And you're 6 feet apart. That's not going to be the same as you being in in my office, like my physical office with the door closed and the windows all closed for an hour. So it depends on the length of time you're there and also how realistic it is that people can stay 6 feet apart from each other. Sometimes you look at places and you'll see how many people are going to be there and you're like, there's no way people are going to be able to social distance in that kind of a setting. So it depends on a lot of different factors. In general, we don't know the magic number. It has to do with how ventilated they are. Are they using HEPA filters, which can sometimes filter out as much as 80% of the air at a time? Using HEPA filters, are the windows open? Is it well ventilated? Tall ceilings? Are people going to be able to be 6 feet apart for a reasonable amount of time? Those are things that I would consider. I've been to a wedding in the during the pandemic, but it was at an outdoor kind of a rooftop, lounge area or whatever. So we were actually outdoors, even though we were kind of covered. And everyone was spread apart. They had chairs for family members to sit together, but then the next group of chairs was 6 feet apart. And they even had they went out and literally measured them on the floor, like they had tape measures out to make sure everything was spread apart. Conversely, I actually chose to not go to a funeral of somebody who I love dearly because I was kind of nervous about just how packed it was going to be. And I just didn't think there was any realistic way that everybody could really be social distance.
The same for you, Brother Jenny.
I'll just add to it. One of the things that I've noticed that, and this changes all the time, the numbers right now in the southern states, because we're still able to do the outdoor kind of thing, is a lot better than the northern states. Where I just left, Michigan was #1 for coronavirus at the time I was there, so I had to cut my trip short. I was staying at a hotel and I wasn't comfortable, so I cut my trip short. So I just think, again, if you can be outdoors at all, for any type of those gatherings. I was absolutely kind of surprised when we had the Braves win the World Series and they had all those people congregating over at Truist Park, and we didn't have an explosion of coronavirus. And the only thing I can contribute to was the fact that it was outdoors, it was ventilated, and people, because they were not 6 feet apart. I mean, people were on top of people, but people wore masks. So if you can continue to wear your mask, and in our houses, when we do have a gathering, try to limit the number capacity to what's appropriate for your house. And I don't know the exact number. Dr. Reddick said this, we don't know. But if you got a 1,800 square foot house, I wouldn't try to bring 200 people in there. I would really try to limit that to maybe 20 people in an 1,800 square foot. And I'm sure I could probably figure out the math on how many people can be in an 1,800 square foot house. But, again, if you can set up some people in the kitchen, some people in the dining room, some people in the living room, and just kind of have everybody spread out. Now, we did get in a circle and do the prayer prior to the meal. And once we got the meal and everybody started eating, we kind of spread out. We opened the sliding glass doors to get the ventilation in the house and do those kind of things. So all those things I think are very important. And the only other thing I want to say is, as it relates to churches, we're back in service. But again, we are continuing the social distancing in our church. We're going to be in watch night service, but we're going to do the social distancing. And we have a pre-registration where you have to sign up prior to coming. So we have an idea of how many people are going to be there. We're not going to turn anybody away, but we want to really try to keep that number within what our number is for our church, so we don't be over capacity and put people at risk. Because ultimately, you can potentially put other people at risk if you don't adhere to these kinds of measures.
We've got a couple of questions. Dr. Reddick, if you would answer, how do I protect my unvaccinated kids during this season? No, there's flu and COVID.
So as far as the flu vaccine goes, kids are eligible to get the flu. So you can actually give it to really young children. So the flu vaccine, like every other year, is still available to kids. For the coronavirus vaccines, obviously you can only give it to kids that are 5 years and older. So we're talking about kids that are between the ages of birth up until 4 years old. So those are really 4 years and 11 months and 29 days. We're talking about can't get the vaccine. So the good news about, as far as, again, is number one, for flu, there's a vaccine against that one. Two is that the same measures we've used for coronavirus work against flu. So wearing masks, washing your hands, those kind of things. If you have a really major exposure, go overboard if you have to. For me, before the vaccine came out, I did have some significant exposure to coronavirus just in my line of work. And there were some times where, something happened where I was a really, really high risk exposure. And so there were times where I actually was apart from my family until I got 2 consecutive negative tests apart, where I literally was sleeping upstairs and telling my kids to stay 6 feet away from me and wearing a mask whenever I was indoors with them or in a car. So if you're in a high risk line of work and you're around your kids, do the same things you would do to somebody else who was unvaccinated that you were trying to protect. Now, the good news is that with coronavirus, for children, for whatever reason, it does not tend to affect them as bad as it does adults. So there's been much fewer coronavirus deaths in children. They tend to not spread it as easily as adults do. So that's kind of the good news, where I tell parents not to get too worried about it. Still be vigilant, still practice all the things we're saying right now. The most important thing you can do is get vaccinated yourself. But if you're doing all those things, don't get too worked up about it, because the good news is that kids in general don't tend to get as sick from it. And again, if your kids are 5 years and older, get them vaccinated, and definitely make sure you yourself are vaccinated.
Lastly, you probably want to know that a couple questions as it relates to the vaccination rate in Georgia. And literally, when you think about that, is the numbers going up or down in Georgia right now?
Yeah, we've had a little bit of a surge in vaccinations. I think everybody's scared. The media's been going wild about this new variant. So there have been a surge of vaccinations. We got to the point where almost all the vaccinations we were giving were just people for boosters, because at one point we were kind of like, well, people who haven't gotten it by now just aren't going to get it. They're not convinced. I don't know if I can say anything to convince anybody else at this point. So, I don't know. But then all of a sudden, the past week, I've seen a group of people. We had our mobile clinic this morning, and we had people showing up who had not been vaccinated at all before, who are like, yeah, my mom's getting on me. I got to get this vaccine now with this new variant, or my wife's been bugging me. I got to go and get it now. So, so they're starting to go back up. The Georgia rates are definitely lower than the national average. We are glad that we did finally pass over 50%, but the nation just passed 60%. So Georgia is still lagging behind. And unfortunately, the states that have the lowest vaccination rates, if you take I can't remember the exact number, I think it's the 10 lowest vaccinated states, the death rates in COVID and the hospitalizations are significant, like several times higher than other states, sometimes as much as 8 times higher than the states that have the high vaccination rates. So, so in Georgia, we're starting to see it pick up again. We're lagging behind as far as vaccinations, and we are unfortunately leading in terms of deaths and hospitalizations, along with a lot of other states in the South.
And I'll say this to that. Dr. Reddick just said this. I don't use the word hesitancy anymore, because at this point you're just reluctant. If you haven't gotten the vaccine by now, you're beyond hesitant. So we really do have to continue to put. I love the story about the mom is telling him he's got to get vaccinated, and that's the reason. So we got to use whatever measures we can. If it's shaming, and I don't want to say shaming, but if the mom is requiring or asking the son or children to get vaccinated, me in my house, I have a daughter that's in college, and believe it or not, I'm on the Health Equity Council. She's against the vaccine, well, she can't come here. So now she's decided, well, Dad, you know what? I want to see you, so I'm going to get vaccinated. So I was like, okay, I'll even drive you now. You can get in the car with me with a mask on. But it was just that kind of pressure to require her to get vaccinated. And I think it's going to take that type of effort to get us to turn the corner. And as Dr. Reddick said, you know, we were at 41% for a while. And then all of a sudden we had an uptick and we got up to 50, but we're still below the national average. And all this stuff, not all of it, but a lot of this can be prevented. If people just merely get the vaccine, we would not have the number of deaths and hospitalizations. And I don't understand why people don't realize or understand that you can keep yourself potentially from dying or being in the hospital by getting a shot.
You know, we got a few housekeeping and we're about to close. So I know it's a repeat, but many of the individuals who are just logging in had questions. One, obviously, is Omicron virus in Georgia? 2, really, what is, if we can close out with you, Dr. Reddick, first, give a couple of minutes on how to manage being in a moment where you're around unvaccinated people for the holiday and moving into the next year. And then we'll talk about socialization with Brother Benning. But if you could just, because many people don't know, they might ask what kind of mask or what mask, but if you kind of give a rotation on what we've already covered for those who didn't get it and are just logging in.
So any mask is better than no mask. So I won't repeat my kind of disgusting example from earlier, but anything kind of blocking your face is going to do it. So even if you see people with the kind of the little, I forget what they're called, the little neck wraps that kind of pull up, those aren't the best, but they're better than nothing. A simple surgical mask, like a regular mask, is better than nothing. In order, the N95 masks are kind of the best ones that you can have, but those are sometimes not available to people, just to the layperson. Shortly, kind of closely behind that are kind of the KN95s that you see a lot of people with, or either the KF94s, like those are kind of the next kind of tier of ones. Behind that is kind of your regular surgical masks, especially like the level 3 mask. But there's, again, any of those is okay. A cloth mask is better than none. And again, the biggest benefit is you not spreading it to other people. It does help you not make you less likely to catch it as well. But the biggest benefit is about you helping other people. So it's not just, you know, if you feel comfortable yourself and say, well, I'm not that worried. I feel like I'm low risk. If I catch it, I don't really care. At least have some compassion to other people around you who might be immune suppressed, who might be elderly, who might be a transplant patient, a cancer patient, HIV positive, whatever the situation is. So I just remind people about that again. As you're traveling, the typical stuff we said, hand washing. If you're indoors, try to stay more than 6 feet apart from people, especially if you're going to be around them for more than 15 minutes at a time. Just continue to do those things as well. And again, the good news is that this new variant, the vaccination does seem to be working with it so far, especially people that have had boosters. The symptoms in those situations tend to be very mild. The first case that they announced in the United States that happened in San Francisco, there was an interview the day after the person contracted it. They identified it, and within 1 day he was feeling better, but he was fully vaccinated. So so that's the kind of reminder about people is stay vaccinated, get those masks in. Again, any mask is better than none. If you have your pick of the litter, then go with the N95 mask. Kind of shortly after that, the other the ones with all the letters and numbers in it, the KF94, the KN95, kind of your next tier. And if not that, then a regular surgical mask or either a cloth mask after that.
Closing, Brother Benny, as it relates to gathering and what just kind of, if you would recap how to gather safely during this holiday and travel season.
So the main thing I want to say, and again, thank y'all so much for having me and having Dr. Reddick here this evening. This was really a good, informative session to get information out to people. So I just want to say, though, the main thing is try to be as safe as you possibly can. Try to do all the mitigating factors, i.e. washing your hands, social distancing, and do it responsibly. We want everybody to be together, and we, kind of turn the corner a little bit with the vaccines. But if you're vaccinated, enjoy yourself, but do it responsibly. It would be the same as drinking and driving or whatever. You're not going to go drink a fifth of liquor and get behind the wheel of a car. You're not going to go and not be vaccinated and go to a place with a bunch of people indoors with no mask on. So we're asking you to try to do all those things that you can, but primarily get the vaccine. I mean, if you're vaccinated, then you probably can go ahead and socialize and be with your family. Do it responsibly. Try to do ventilation if you possibly can. Try to do indoor social distancing if you can. And just do all those things to be safe. If it makes sense, I have an adage. I'm like Judge Judy. If it don't make sense, it ain't true. If it makes sense, it's probably true. So just do those common sense things that really make sense to you that you should be doing, and then you should be okay with that. And as Dr. Reddick said, please get vaccinated. I mean, if you haven't been vaccinated at this point, you're really taking not only your life at risk, putting your life at risk, but you're putting all the rest of us, our lives at risk as well.
Brother C, can I make one last comment?
Yes, sir.
Just one thing. I think it's been said a lot, but I just want to make it very, very clear. One criticism I've heard is that people say, well, these variants keep coming out, and you got to keep getting boosters, and people catch COVID anyway with the vaccine, so why should I get vaccinated? The big take-home point I want to make sure everybody's clear on is that if you get the vaccine, you have a close to 0% chance of dying or ending up in the hospital. There was one study I saw recently where there were 1,700 people that were hospitalized or died from COVID. And out of that group, less than 10 of them were vaccinated. And out of the ones who were vaccinated, they were typically people that had problems with their immune system or were very elderly. And in elderly people, you tend to have a waning of your immune system as well. So for people that get vaccinated, especially if you have no immune system problems, you have as close to a 0% chance of dying or ending up in the hospital as you can possibly realistically have. So that's the main reason to get vaccinated is, yeah, it'll stop you from spreading it to other people. Just on a personal level, you are not going to die or end up in the hospital with COVID, almost no chance if you get vaccinated. So that's why when we say the vaccine worked, that's what we mean. It doesn't mean you won't get a cold, right? The coronavirus has been around forever. When I was in med school, we learned about the coronavirus when I was in med school 20 years ago, more than 20 years ago now. We knew about it back then. It's the second most common cause of the common cold. This is a mutated form of it that's causing problems. But again, if you get vaccinated, it goes back to the old coronavirus. It's just, even if you catch it, just bad cold, probably be better in no time. So that's the reason we're telling people to get vaccinated. You're probably not going to get sick enough to end up in the hospital or die, and you're way less likely to spread it to other people.
Well, we want to thank everybody for having us. Clearly, I'd like to thank Dr. Reddick. I'd like to thank Dr. Benny, Mr. Benny. I'm sorry, I make you doctor no matter what it is. I'll be your doctor anyhow. But you're the brother doctor, dear doctor. When it comes to it, we want to thank everybody. Please gather safely, no matter what you do during the holiday. Test often. Definitely get vaccinated. Encourage your community to join the movement of being safer and healthier as a community. And that's all of America. All of America get healthier. I think it's important. You can definitely get connected to the Georgia Department of Public Health's website and the CDC for updates, and stay safe during the holiday season. We want the community to live. We want the community to move forward. And we want you to trust the health professionals. Clearly tune in and trust those voices who are outreaching right now today for all of us to be safer. Thanks to our commissioner, Tony, for all of what she's doing to make this a bigger and better movement in the state of Georgia. Thanks so much, everybody, and good evening.
Good evening.
Right.